Hello, and welcome to today's session on shingles and African Americans over 50, what you should know. I'm Tamara Brock, and I'm in partnership development with Black Health Matters. Did you know that 1 in 3 people will get shingles in their lifetime? Shingles is a painful skin rash that can interrupt your life for weeks. And if you're one of the 99.5% of people 50 years and older that have had chickenpox, the virus that causes shingles is already inside of you. Please help me welcome highly sought after physician leader, Dr. Sheri Prentiss, as she leads us on a discussion about what you need to know about shingles and how to prevent them. Dr. Prentiss?
Super excited to be in front of you guys today, but before I get started, I have to deliver my messages, my disclosures. Dr. Sheri Prentiss is a paid consultant for CN Plus. CN Plus is the marketing agency engaged by GSK. Okay, now on to the good stuff. What do you need to know about shingles? So today I want to cover, well, what is shingles? I'm a doctor, so obviously I'm not talking about roofing. So those are not the shingles I'm talking about. What are the symptoms of shingles? What are the possible complications of shingles? Who is at risk? And then we're going to start the conversation. So let's start off. What is shingles? Well, shingles is a painful, blistering rash that usually erupts in a single stripe on either the left or the right side of the face or body along a nerve path. And it could develop either on the torso, arms, the thighs, or the head, including the ears and the eyes. Shingles is caused by the same virus that causes chickenpox, and that virus is called varicella-zoster virus. After a person recovers from chickenpox, that same virus stays dormant in the body and can be reactivated years later as shingles. So what are the symptoms of shingles? I'm talking about it, but why do we need to care? Well, let's find out the symptoms. Typically, there is pain or itching in the area where the rash appears. So you may feel some pain and itching even before you see the rash. Then this rash develops into these fluid-filled blisters. Sort of sound like chickenpox, don't it? Now, what you need to know about this rash is that when people describe the pain that's associated with shingles, it's usually described in 3 types: either a burning sensation, stabbing pain, or electric shock, or a combination thereof. Other symptoms of shingles can include fever. I feel like I'm saying a commercial. Fever, headache, chills, or stomach pain. But that is the reality. It can cause either fever, headache, chills, or stomach pain, in addition to this blistering rash that is painful and described as either burning, stabbing pain, or electric shocks. So after you have the symptoms of shingles, what are the possible complications of shingles? Well, the most common complication that has been expressed is something that we call post-herpetic neuralgia, which impacts about 1 in 10 people who get shingles, and it causes a severe pain that can last for months or even years in the area of the healed rash. So the rash goes away, but you still feel this pain in the area where the rash once existed. In addition, some other possible complications include scarring where the rash was, visual problems if it occurred on the face and around the eyes, and partial weakness or paralysis of the areas served by the affected nerve. So you can imagine if it affected the face, you could have droopiness of the face or droopiness of the eyelid, because that was the nerve that was affected. So, who is at risk of shingles? Why are we even talking about this? I think we can figure out, maybe we may be. 99%, in the US, 99% of individuals 50 years or older already have the varicella zoster virus dormant, laying inside of them, even if you don't remember having the chicken pox. So even if you don't remember it, you're most likely in that 99%, if you're 50 years or older, that has the varicella zoster virus, the same one that causes chickenpox, same one that causes shingles, already inside of you, even if you don't remember having chickenpox. So I want you to look to the right, wave at the person to your right, and then look to your left, and then wave at the person to your left. And then I want you to realize that 1 out of 3 people will get shingles in their lifetime. I'm just saying. So, as a person ages, our immune system weakens. It begins to weaken, making it less effective in preventing the varicella zoster virus from reactivating. That's why the risk of shingles increases with age. So let me repeat. As we age, our immune system weakens. Therefore, it's not strong enough to fight off the varicella zoster virus from reactivating. That's why as we age, it increases our risk for shingles. So let's start the conversation. If you or someone you know is 50 years of age or older, it is so important that you talk to your doctor or pharmacist about shingles. So let me wrap it up for you. Shingles is a painful, blistering rash that usually erupts in a single stripe on either the left or the right side of the face or the body along a nerve path. And it could occur on the torso, on your arms, on your thighs, or on your face. And if on your face, it could be around your ears or your eyes. Shingles is caused by the same virus that causes chickenpox, and that is called varicella zoster virus. So if you have had chickenpox, even if you don't remember it, you can develop shingles. And shingles most often appears in individuals 50 years of age and older. I want you to visit whatisshingles.com so you can get further information, because my time with you is limited. But I want you to make sure you go out to this website, whatisshingles.com, to gather further information. Remember, talk to your doctor or pharmacist about shingles and how you can protect yourself against shingles. Thank you. Wasn't that easy? And now there's an opportunity for questions. May you come to the mic so I can hear you? Thank you.
Hi, thank you so much for your presentation. Excellent presentation. Truly appreciate it. How effective is the vaccine against shingles?
Great question for your doctor and your pharmacist. I need to be careful. We know how effective other vaccines have been, do we not? We all went to school and had to have vaccines before we can even go into school. We've had the COVID vaccine. So I recommend to you, I would not advise anyone to talk to their doctor or their pharmacist about the risk of shingles if there wasn't a possibility out there that you could be protected. I hope that best answers your question. You got it.
Hi, I was one of those people that got shingles before the age of 50, and they said it could come back. So, like, what are things that you need to be aware of that might come back? Or, and then also, if you had the shingles already, when I get to 50, do you still take the shot or no?
Well, if you've already had shingles, you said one of the things, what can I be aware of? Well, you already know what the symptoms are, right? So now you know if I'm feeling pain or itching in a particular stripe, because the nerves innervate our bodies in what we call dermatomes, meaning a single nerve will cover this particular area, then the next nerve will cover that particular area. So when you feel like kind of like along the same line, like going across here, and I'm feeling the pain and I'm feeling the itching, then you need to get prepared. Get prepared and do so and go see your doctor prior to actually seeing the rash. And certainly if you see the rash, get to them before it develops into the blisters, because there are things that can be done to make it more comfortable. Between now and then, since you've already had it, again, talk to your doctor or pharmacist, because there are steps that you can take that would possibly decrease your risk of developing it again. Go to that whatishingles.com. I believe you'll have a lot of your answers right there.
Okay, thank you.
I love that mask. You can just, if you just drop it, and, yeah, I got it for you. Go ahead.
Okay. Hi, my question is, very brief. People you said that could get the shingles, they in certain parts of their body. Could they also break out in their back, on their back?
Well, part of your torso. So if you see how the nerves follow, when they come off the spinal cord, these nerves wrap around. And so, yeah, torso doesn't mean just here.
Right.
Torso can wrap
like
all
upper
around
part
here.
of the back or anything. It could be anywhere.
A nerve dermatome, wherever
Right.
that nerve is going, it can lie dormant, and when it reacts, it's going to hit in the area where it lay dormant. Yes.
Thank you very much.
Good afternoon. I had chickenpox when I was 3, and it was highly contagious. All 3 of my sisters, we all had it at the same time. Is shingles contagious as well?
Remember chickenpox? What did they tell you about chickenpox? You had to stay home, right? You couldn't go to school. Similarly, if your grandmother gets diagnosed with shingles and you have them, you don't want her around the little kids, the babies, or someone that has not been appropriately protected. Yes, it can be, especially when it erupts. Is a rash form where there is no open lesions? No. But when there's blistering and there's open lesions, if there is another individual whose immune system is compromised, yes, you want to keep them away from that individual until they're fully healed.
Next question. Chickenpox has been around for a long time, and why is it now we're hearing about shingles more often? Because when I was young, I didn't hear about shingles at all. So I know people were probably still getting it, but it wasn't like not talked about, because I'm just hearing about it like the last 10 years.
Again, as individuals' awareness increases and you put the information out there, again, in our socially technological age that we're in now, more things that we didn't hear about then are coming to the surface now. And I'm grateful. I'm so grateful for my fellow Black community saying, you know what? We need to educate ourselves more and learn more and get out in there. So part of what you're hearing is individuals requesting and seeking more information. You are right. It was happening then. Breast cancer was happening then. But I don't think you can go anywhere or be on anybody's program and not have some attribution to breast cancer. So it is just how we have evolved over time. And that evolution has said we need to take better care of our health. So if we have limited time with the physician when we go in, what can we do to advocate for ourselves? That's why you're hearing it more. We're advocating for ourselves. Yes, ma'am.
Okay, Dr. Sheri, you answered a question for this beautiful young lady with the great braids. Can you get shingles twice? Because she's had it before.
Yes, you can.
And yes, you can. So
Yes.
Thank you for answering that with the first, with one of the early questions. But what if you've had it, like she had it? Since she's had it, does that mean that she should still go get vaccinated? Because she can get it again, right?
You should definitely seek additional treatment, just like when an individual was diagnosed with COVID. that did not preclude them from getting the COVID vaccine after they got over that initial wait period of time. So absolutely, because it lies dormant in your body, when it reactivates, you get the symptoms, and then it goes back dormant again. And if you don't do anything regarding treatment or prevention from future attacks, that dormant virus can be reactivated again. Yes.
Thank you, Dr. Sheri.
Sure.
I'm trying to find out why they don't have a cure for it.
Well, you know what? We're saying that about a lot of things. We're saying that about a lot of things. And so when we talk about cure, again, when you are working within the field of medicine, there are certain medications that you can take that will prophylactically prevent you from getting a condition. Consider the availability that you can find at the whatishingles.com site as the ability to prevent conditions. I don't think at this point you will never be able to cure it because the varicella zoster virus exists. We cannot get rid of the virus. But what we can do is protect ourselves from having the repercussions of that virus being activated in our bodies.
Thank you.
You're welcome. Wonderful. If there are no more questions, thank you so much for your time and attention, and I hope this has been helpful. God bless.